similar situations all over, and that is why human to human chain was to be broken, and that is why lockdown became very important, and there were stringent measures in implementing the lockdown. Next slide. Right. Now, what can we do? We have identified the problem, and what can we do? Solutions. What are the solutions? Now, please understand, the moment the lockdown is loosened or the lockdown is withdrawn, no, the virus will not go away. I find a question there, how long would the lockdown go on? I think the unlock has already begun. There is something called Unlock 1, which we are through in the national level, and at the state level, I think by this weekend, the strict lockdown gets loosened and we go back to what we were in the lockdown 5, aka Unlock 1. Now, the virus does not understand lockdown and unlockdown. So the virus will not say bid farewell and go away the day we remove the lockdown. But then we cannot endlessly go on a lockdown. So we would have to understand what we do. The virus will stay here. For how long? No one knows. What can happen? The virus can keep on mutating. As I told you, it's an RNA virus. So it can keep on mutating. As it mutates, on one side, it's a 50-50 chance it can become a virulent strain, or the other chances it can keep on weakening itself, and somewhere we find the virus weakens. Very happy if it weakens. But then what is the greater possibility? As many of us develop immunity, as many of us get exposed and develop immunity, the virus will remain in small pockets somewhere in some country. So it will become endemic to that area. Instead of an epidemic, it will become endemic to that area, and it will remain in small pockets, maybe show its head once a year or once in 3 years or once in 4 years, or may not show its head for 2 decades like what SARS-CoV-1 has done. So the virus will not go away is what information we'll have to carry at the baseline. The baseline is right at this point of time, we need to reduce the number of infections, and we also need to reduce the number of deaths. Why is it important in a country like India? In India, the population is below 50. 50% of the population is below the age of 55. So we cannot afford to lose lives. So if we cannot afford to lose lives, we probably will have to think of a way where we can contain the disease. That is why containment becomes important. All our prevention measures become important. Now, what do we do for this prevention measures? We can think in terms of 3 areas: personal hygiene, distancing hygiene, and environmental hygiene. I do find questions on the symptoms. I'll come to that. Maybe yes, I'll tell you about the symptoms and then go to the prevention methods. Symptoms, very varied. Somebody was asking a question on what are the types of illnesses that it can cause. I tell you, nothing is very clear about it. When Wuhan reported, we thought in terms of a pneumonia. Lung signs and symptoms, people appeared to have pneumonia. But then you would have seen in the papers, after some time, it is not only pneumonia, it's something else also. Now what happens? There are possibilities that someone develops a pneumonia. That is one group of people where the virus would have gone into their lungs. It sits there in the lungs. And because of the virus, there is some reaction that's happening. And those chemicals, which are antivirus, they go and try push the virus in the lung gets loaded, so you get a pneumonia-like picture. There are also individuals where the virus produces coagulation, blood clotting within the blood vessels. Now, blood vessels are all over the body. So blood clots can occur in the region of the kidney, in the region of the liver, in the region of the brain, small clots, and that particular organ can go out of control. So the symptoms are variable. I would just give you a list of symptoms. Please be careful. Immediately seek medical help if any of these symptoms appear. Sore throat, dry cough, some kind of cough which continues, persists for about 3-4 minutes, you're not able to control, such kind of a cough, fever, 2-3 days on and off, even the first day, don't ignore it, seek medical help. Normally, the course is first 2 days fever, third day, fourth day, some kind of throat problem, and then it progresses. And don't wait to that initial thing that people was talking about, that, if you find yourself breathless, go to the doctor. Please try and seek help even before that. If you have facilities to monitor your oxygen level, it's a good thing. There is a small little WHO approved test that many of you can try on your own selves if you have a doubt. You walk for 6 minutes, brisk walk for 6 minutes. If you can make that walk without breathlessness, you're able to be normal after a walk for 6 minutes. Comparatively, your oxygen saturation is quite high. If you are not able to walk for 6 minutes brisk, that means your oxygen saturation is falling. Seek medical help. Now, other symptoms can be, most important is sleeplessness. If someone has sleeplessness, you don't have any reason for having a sleeplessness, suddenly you're up in the bed, you're not able to sleep, please seek help, because if there are multiple clots somewhere close to the brain, sleeplessness could be the symptom that manifests itself. I do find some people smiling when I say sleeplessness. That's a common thing that many of us undergo, stress related. Now, I'm not talking about the stress related, nothing wrong in seeking help. If you think you're not able to breathe, the reason is if you're not able to breathe when you sleep, you suddenly get up and then you're not able to lie down, you find it difficult that you're not able to breathe. That is a kind of sleeplessness that I'm talking about. We've seen patients have had insomnia for a week's time, but then daytime they're normal. They've been talking over the phone and all that, walking into the hospital, but then you find the oxygen saturation is much less. So when you're sleeping, the oxygen saturation tends to go down because your muscles are not very actively working on the respiratory mechanism. So if you have such symptoms, please try and get medical help. Some kind of changes in the fingers, if you find your fingers are turning kind of dark in color, some kind of bluishness in the fingers or the toes, that is also a symptom wherein you would have to immediately seek help. Now, I find a question there, which is a pretty long question. Let me read that question. When a COVID positive patient returns home after hospital treatment, these days they are not done swab test if they are negative, because how long to maintain distance from them? A maximum of about 2 weeks. A person comes back home, still practice quarantining and distancing for a period of 14 days. I think that answers the question. Now, there have been several questions in between. Now, let's go to the prevention part of it, and I'll then come back to the co-vaccine and other things. Now, with regard to prevention, let's try and keep it in 3 areas: personal hygiene, distancing hygiene, environmental hygiene. Now, next slide. When I say personal hygiene, all of us understand what are things that we need to do. Keep your distance from an infected person, and don't ask me who's an infected person. The baseline is, let us imagine everyone is infected. You come to my office, think that I'm infected. So I should not spread it to you. You should not spread it to me. That is the baseline that the educated lot can think of. Everyone is infected because all of us can be asymptomatic. So you do not know who's an infected person. Keep your distance from everyone. If you're in an office surrounding, try and keep your chairs away. Don't have too many visitors. See to that you maintain a distance of about 6 feet from everyone. And the other thing is most important, knowledge of immunology. No, you don't have to need to know much about immunology here. Now, the second thing is, please wear your mask. I don't have a picture here for the mask. The picture comes later. Please wear your mask. Next picture. Now, the face mask is absolutely essential for everyone. The reason you can see in this picture, there is one lady who's infected but asymptomatic. Now, when she speaks, she's throwing a lot of viral droplets. And just see, there are two people standing opposite. Both of them are healthy. One is wearing a mask, the other one is not wearing a mask. Now, the person who's not wearing the mask is getting all the droplets on herself, because the other one has a mask, the droplets could not penetrate, percolate, and go there, but this one is at maximum exposure. So the infected asymptomatic person, if that person wears the mask, you find the droplets, the incidence and the number of droplets is much less. So it is mandatory that everyone practices, trains. We might not have been used to this. Yes, it's a little difficult. It's a little difficult to speak with the mask. I'm right now speaking without the mask primarily because there's no one else in this room. And I would do a sanitizing of this room after I finish. But then, please wear the mask definitely. Now, if you're in your house, do you need to wear the mask? Not necessarily with your whole home contacts or your household contacts. But if someone comes in, this is especially for women and the others who take care of the household. Now let's imagine an LPG cylinder you have ordered for, and your LPG man comes. Please wear your mask and then let him in. You have your carpenter coming in, please wear your mask. And I find a question on the cloth mask. Yes, for the community purpose, the cloth mask is enough. Unless you're a healthcare professional, getting into the laboratory or getting into the ward, you're a frontliner in the COVID battle, you don't have to bother about the triple layer mask or the N95 and so on. A cloth mask is well, but the cloth mask will have to have at least 2 layers, not a single layer, a 2-layered one, and preferably a thicker cloth mask than the one that you have, the banyan kind of cloth, because the porosity in such cloth is, it's a large pore. But then the cloth mask with 2 layers is sufficient for community purposes when you go to the shops, when you travel in the community, or when you're in your house, when someone else comes in. The point here is, when someone else comes into your house, please ask them to wait, wear your mask, and then let them in. Don't think that you're inside the house. Because when we went in for history, there were people who were saying, there was no way I came in contact. I was sitting inside my house only in the lockdown. But then if you trace, they would have just chatted with the neighbor across the compound wall without a mask. You might think that you have not gone out anywhere, but then the compound wall and the compound wall area and the neighbor could have gone out elsewhere, and all that, could be a route of transmission. So the mask is a primary necessity, especially when you travel anywhere. Don't forget your mask. The next is distancing hygiene. The social distancing part of it, you could see 2 pictures there, both of them emphasizing on the social distancing. I know it is a misnomer. It is physical distancing. Tani mani the idaiveli is what we want, not the technical social distancing part of it. You find when 2 people shake hands or when they are close to each other, human to human transmission is more. The other graph shows you, when you reduce human to human transmission by physical distancing, you find the graph is shortened and also delayed. You see the taller graph, more number of cases in a short period, but here you'll find the second graph where less number of cases in a longer period, so that even the healthcare system will be able to cater to the demand. Next one. So what are the other things that we can do in personal hygiene? Please maintain the self-hygiene, the kind of hand sanitizing. Not necessarily you will have to use an alcohol-based sanitizer. The soap and water is sufficient. The logic here is soap will be able to break the envelope of the virus. If you remember the picture of the virus, the envelope of the virus is broken by soap. What happens when the envelope is broken? The genetic material is exposed. After some time, the genetic material disintegrates. That is the reason we say even surfaces, your dining surface, your dining table, your work table, your whatever surfaces you have at home or office or whatever surrounding, keep disinfecting them, keep them clean with Lysol or some kind of disinfectant where Lysol or soap or alcohol will be able to break the envelope. Once the envelope is broken, the virus cannot replicate, it kind of disintegrates. And clean surfaces, which is part of the environmental hygiene. Use sanitizers when you don't have access to water. So it's personal hygiene, distancing hygiene, and the environment, which is to avoid the fomites. Now, there are lots of questions coming in. I'll touch upon some of these questions. There is some question on the immune booster through alternative medicines. I think somebody asked about milagu, tipili, and all that. Yes, many of these formulations and the condiments, the spices that Indian system of eating uses do have immune booster property. So you can use these. These would be helpful even for normal people, even for quarantine people. They can serve as immune boosters. That is what the Siddha formulation and some of the Ayurveda formulations like Kabasura Kudineer or Nilavembu Kudineer, which are all kind of, formulations which improve the immunity system. What can be done simply at home is that you can take any of these immune boosters, tulsi leaves, karpuravalli leaves, your black pepper or milagu, tipili, vettalai, all these do have immune boost property. So you can probably prepare your own concoction, nothing wrong, but don't say that this will be curative. It cannot be curative. The thing is, the borderline is very thin. You can take all these immune boosters, but then don't ignore symptoms when they appear. Don't say, no, I've been taking these immune boosters, so it will not come. Don't go into that kind of a denial mode. So make your concoctions. You can boil a little water. In boiling water, you put in some tulsi leaves, some karpuravalli leaves, drop in a little pepper powder, maybe turmeric powder, and one vettale. You can make it into pieces, put it into the same concoction, make it to boil, and then drink it. It's good. If you want taste, add a little salt. It tastes like any of the South Indian rasams, and you can take it also. Nothing lost. Have a lot of vitamin C. Going for Nellikai and tomatoes, you can have lots of vitamin C. You can take vitamin C tablets and go for zinc, because zinc, vitamin C are immune boosters. But don't ask for definitive curative evidence in COVID-19 for these. We have not found them as yet. So there are lots of social media information going on. This is waste, nothing is happening and all that. No, these are good immune boosters. Have good food, keep your mind calm. One of the most important things which will act to give good immunity is keeping the mind calm. Don't go in for some kind of agitation. Don't think something wrong is going to happen. No, please remember, most of us will be in the 80% asymptomatic area. So that is a good thing about SARS-CoV-2. Now, this is not a killing virus. So let's remember that we could be in the 80%, and let's try and boost up our immunity to be in the 80%. Remain calm and maintain all the possible hygiene methods. Yes, now arsenic album has been indicated by the Department of Ayush, Government of India. I have no first-hand information. I have no experience of working with arsenic album, but then people do say it is good. I'm not very sure. Now, I have no answer to this question on earning money through vaccine and all. I have no information on that, and I do not know about it. I wouldn't want to comment on something which I do not know and not aware of. But then lots of studies on the vaccine are going on. Several people are working on it right now. Even in our own country, there are about 30 candidate vaccines which are being tried. Let's hope that something comes out. But then please remember, for a vaccine to come out after clinical trials and after approvals, it will take quite a long time. Not less than a year would it take. So probably waiting for a vaccine is something long. We'll have to wait for at least 12, 18 months. So probably vaccine will not be an immediate thing. Now, what about herd immunity? Thanks a lot for that question. Herd immunity. Now, let me tell you what herd immunity is. Let's say 100 people are there. A very, very brief description about herd immunity. Let's say 100 people are there. 80 people get exposed to the virus. As every individual gets exposed to the virus, each one of us develop immunity. There are immune cells which are trying to fight the virus. But then, not all of us would develop good immunity. Before we develop the immunity, we may fall a prey to the virus. The disease could catch on to us. That is one. Second thing, if we have slow and continuous exposure, we may develop herd immunity, but that will take a long time. It will take about 6 months for the herd to develop an immunity. Meanwhile, what will happen? Of this 80% of people who are getting exposed to the virus, 20 people might die. So we don't want that number of deaths. That is why we are not waiting for herd immunity. And what happens exactly in herd immunity? 80 people are exposed, 20 people are not exposed. The 20 people are the old and the very young who are not exposed. The 80 people who are in the periphery. Now think of a circle. Just make 80 people stay in the periphery of the circle. 20 are right inside. The 20 are the old and the young. The 80 in the periphery are the middle-aged or people who can get exposed easily. Now these people will develop the herd immunity and break the virus. Now 80 people standing in the periphery. Let us imagine the virus is trying to come into that circle. The 80 people standing in the periphery, if they have immunity, they will prevent the virus from entering into the circle. So the virus need not or cannot come into the inner 20. That is what the herd immunity principle is. But the 80 who are standing in the periphery should all develop immunity, which might not happen if some of them have low immunity, they have some other diseases like diabetes or anything else, they may succumb to the disease. So herd immunity is a long proposition. Before we develop herd immunity, we may lose lives. That is why we are not thinking of exposing everybody, and that is why we want a chain to be broken. Now in smallpox, just to give you one inkling, smallpox, we have a herd immunity now, but then smallpox affected the human community 12,000 years ago. And it's taken such a long time for the vaccines to appear, immunization to appear, and then we develop the herd immunity. Now, regarding the local formulations, our own, Siddha and Ayurveda formulations, there are studies which are going on. It has been noticed that some of our herbs do have antiviral properties, like the Chittarattai, Nochi, Kadukai, Neer Brahmi, Pirandai. All these have in the initial phases of study shown antiviral property against COVID-19 virus. If you remember the picture, I showed you a spike and I showed you a membrane. Now these do have some kind of antivirus property, but then the second phase of study, the animal studies and all that needs to be done. Without that, we cannot 100% definitely say that there is an antiviral property. So please wait for all these studies to happen. And regarding the MMR vaccine, yes, I also saw the news information, but we are not very sure. We're not very sure because the rubella virus and SARS-CoV-2 virus are definitely different. And we're not very sure if that 30% difference, it has been stated that the 30% difference will not matter as far as the vaccine is concerned, but doubtful. 30% difference in the base pairs could mean something. Something needs to be worked there. Without working, we'll not be able to say if MMR vaccine would be enough. Many studies have been launched throughout the country. Various studies are going on, and probably I only wish any of these studies will be able to give us some kind of path within the next 1 month's time. There are some studies which are close to the second phase and the third phase. So probably in the next 1 month's time, we may get some path, some light through the path. The next slide. So the baseline, I would like to emphasize once again is, let's think, nothing wrong. We're not putting them down. Don't have, don't read between the lines here, don't have legal implications. I'm a little scared to make this statement when I'm with a group of lawyers. Don't think that we are putting down someone by saying, no, everyone could be an asymptomatic carrier. Now, this is a technical thing. Everyone could be a carrier. Let us think that everyone could be lodging the virus. That means I could be lodging it. So I should not have the hesitation to think that I could be lodging the virus. I should not give it to others, and I should not take it from others. So the baseline will be do not give and do not take. So practice all those things which are required. Now, when I say practice, yes, we need to practice. We've not... yeah, I know lawyers are actually very nice people, and that is why I'm with you. Please remember that. I'm not saying lawyers are not nice people. I'm only kind of telling you words are capable of any kind of interpretation. And I don't want to be misread. That is why I'm a little cautious. Maybe, I would have to express it. I do not know if I'm expressing it correctly. So I thought I would be a little cautious about it. The baseline is don't take, practice all those levels of hygiene, especially, when I see people, the two-wheelers in the traffic signals, I'm a little worried. Everyone is wearing a mask, no doubt. But then I find two-wheelers trying to catch space. Now, what is lost? They can be a little away. I find 2-3 two-wheelers close to one another, waiting at the traffic signal. I'm only worried if one of them sneezes, then everyone gets into the danger of transmission. So these are small things which we need to train ourselves. Yes, this is a new circumstance, but then probably, yes, we'll have to remember that COVID would continue to be with us for probably the next year or so, and we'll have to adapt ourselves, and that is what is living with COVID. We would have to adapt ourselves and train ourselves to live with it, but then keep it away, keep it at bay. Thank you very much, and if necessary, we'll continue with the discussion further.
Yes, ma'am. We've got our senior counsel, Mr. M.S. Krishnan. He's a senior most member of the bar who wants to pose some questions to you.
Yeah, sure.
Mr. Krishnan, sir?
Yes. I have two questions. Both of them are connected. I want to know whether an asymptomatic patient develops antibodies sufficiently to protect him for life, or at least for a long time. That is question number one.
Yes, sir.
Question number two is, if an asymptomatic patient develops antibodies, why is it that we are not doing antibody tests to find out the spread? I understand that is much easier. We can at least know what is the extent of the spread by testing, by random testing. These are the two questions.
Yes, sir.
Krishnan, sir, you could have unmuted your video so that we could have seen you.
I'm not on. Now you can see me, right?
I think you can, even Vijay Kumar, you can, maybe you can get out of the
presentation mode.
Now, I was audible, I suppose, right?
Yeah, you're very audible, Krishnan, sir, but we were not able to see you.
Okay. I'm not very sure. Yeah.
Anyhow, sir, I'll answer your question. Sir, as of now, the antibody levels in asymptomatic people is not clearly known. That is the fact. We are not very clear as to what the level of antibody is, if they have developed enough antibodies to neutralize the virus, if they have developed neutralizing antibodies at all. Now, antibodies could be there which need not be neutralizing, or even if they have neutralizing antibodies, if they have developed that amount of antibodies to combat the virus. No, we're not very clear about it, sir. So probably we are too early in the progression of the. What is worrying is, that would answer your second question. Also, what is worrying is there have been reports of reinfection in some countries. So if reinfection occurs, it is a kind of an indication to say that the antibodies are not sufficient. If a person had been infected, had antibodies sufficiently, that person should not be reinfected. Very idealistic. If a person gets reinfected, we're not very sure why the person is getting reinfected, whether it is a new strain or it is a new mutation of the virus, or antibodies are insufficient. Now, there is also a possibility that it cannot be a reinfection, it can be a resurgence. Now, I get infected the first time, I don't develop that amount of antibodies, I become better. But then after some time, the virus could be sitting inside somewhere, dormant inside my body. It could come back. Because some viruses do have that habit. Say, for example, your chickenpox virus goes and sits somewhere. Then after many years, it surfaces as herpes. So we are not very sure as to the pattern of this virus. More studies need to be done. That's why I told you this is a very, very young virus. We just know this virus only for about 6 months. Not much of studies have been done about the neutralizing antibodies, the antibody titer. We're trying to work on it. In fact, even in India, even in Chennai, we're trying to work on it. I suppose your inputs, whatever kind of questions that you've asked, will give us a little more insight to work on this further.
Ma'am,
what about antibody testing, ma'am? Why not we give that an extensive antibody testing? At least
that is it, sir. Right now, we don't know what is the level of antibody. We're not very sure if these antibodies do give protection. And if there is no protection from these antibodies, there's no point of doing the antibody testing. There could be antibodies, because some studies have come from Australia which say there could be antibodies in the individual, but then they are not anti-COVID. Like